According to a new report released by the Centers for Disease Control and Prevention, more U.S. teen girls are experiencing increased sadness and violence. KMR Local 4's Jack Kessler spoke with local experts about how this report sheds light on how teenagers are facing increased mental health challenges.
In this new report from the CDC, nearly 3 in 5 U.S. teen girls felt persistently sad or hopeless in 2021, double that of boys, with a nearly 60% increase in the decade. The report goes on to say that 40% of high school students felt so sad or hopeless that they could not engage in their regular activities for at least 2 weeks during the previous year.
I think what it's shining a light on is that our teens are under an incredible amount of stress. They're under an incredible amount of stress to perform at a very, very high level, to perform academically at a high level, to be able to be, doing 900 things at once.
That increase in sadness in teen girls can be attributed to multiple factors.
One is that it has to do with social media and the impact that social media has on their lives, as well as sexual violence. And because what you see is that teen girls are more apt to experience sexual violence. In fact, it's 1 in 5 teen girls that have reported that they have been involved in some kind of sexually violent episode in the past year. And then there's 1 in 10 that says that ever in their lifetime that they've been forced to be involved in some sort of sexual activity.
Belinda Correlia Palacios, the executive director of the Amarillo Children's Home, says that girls that experience sexual violence can greatly be affected.
Their self-esteems tend to be extremely low. They tend to view themselves only as just a commodity and not a person sometimes, and that can really affect how they engage with others.
The CDC adds that nearly 1 in 3 teen girls seriously considered attempting suicide, up nearly 60% from a decade ago, and 10% of youth attempted suicide 1 or more times. The West Texas area director of the American Foundation for Suicide Prevention, Tracy Summers, says that we have to create honest conversations about mental health.
We have to provide these resources and educations in our communities, in our homes, and in our schools, and we have to foster that environment that it is okay if you do not feel good to talk about it, and really bring the mental health as just an important issue as your physical health.
Also in that report, findings show that high and worsening levels of persistent sadness or hopelessness are across all racial and ethnic groups, and that reported suicide attempts increased among black and white youth. Live in studio, Jack Kessler, KMR Local 4 News. Andy?
Jack, thank you. You can contact the 988 Suicide and Crisis Lifeline if you're experiencing mental health related distress or you're worried about a loved one who may need crisis support. The 988 Lifeline is confidential, free, and available all day, every day.